Here is a question worth sitting with for a moment. How much of your day do you spend thinking about your next bathroom trip? You might have noticed it's not just once anymore. You get up to use the bathroom, settle back into bed, and then an hour later, you're up again. Most people over 60 assume it's just part of aging, but there's a reason this starts happening, and it's not always what you think. Why this matters and who this is for there is a particular kind of exhaustion that comes with overactive bladder. It is not just physical. It is the mental load of mapping out bathrooms before you leave the house. The second guessing before every car trip. The quiet decision not to accept an invitation because you are not sure you can manage. That kind of exhaustion deserves a real answer, not a shrug and not a pamphlet. Welcome to Help the Aging Research. My name is Emily Hart, and every week on this channel we give adults over 55 the kind of clear, evidence-informed guidance that your last 10-minute doctor's appointment probably didn't have time to cover. Today, we are going deep on overactive bladder, what it actually is, why it becomes more disruptive after 60, and the specific steps that give most people meaningful relief. Let's get into it. What your bladder is actually doing. A healthy bladder is a storage system with a communication line. It fills gradually, sends a gentle signal when it is around halfway full, and waits patiently for your decision. You're in charge. The bladder cooperates. With overactive bladder, that communication line gets noisy. The muscle wrapped around your bladder, called the detrusor muscle, begins firing on its own schedule. It contracts before the bladder is genuinely full. It sends urgent signals that feel impossible to override. And sometimes it does not wait for your permission at all, which is when leakage happens. Research suggests that roughly 1 in 6 adults experiences these symptoms, and the number rises significantly after 60. So if this is happening to you, understand that you are not unusual and you are not broken. Your bladder has developed a sensitivity problem, and sensitivity problems can be corrected. The 4 symptoms that define overactive bladder are needing to urinate more than 8 times during waking hours, sudden urgency that is difficult to delay, leaking urine before reaching the bathroom, and waking more than once at night to urinate. That last one, called nocturia, is something we have covered in significant depth on this channel. If nighttime bathroom trips are disrupting your sleep, our video on the 13 reasons doctors want you to know about nocturia after 60 is linked in the description below. Pause for a second. Think about the last time you went to the bathroom. Was it because you truly needed to, or because you felt you should, just in case? Keep that thought. We are going to come back to it. Why 60 changes everything. Age alone does not cause overactive bladder, but several things that happen during and after your 60s create the right conditions for it to develop. First, the bladder wall gradually loses elasticity. A less flexible bladder reaches its comfort threshold sooner, triggering urgency signals earlier than it should. Second, the nerve pathways between your bladder and your brain naturally become less precise over time. Think of it like an old telephone line developing static. The signal gets distorted, and what arises at your brain can feel far more urgent than the situation actually warrants. Third, hormonal changes play a direct role. For women, the drop in estrogen after menopause causes the tissue surrounding the bladder and urethra to thin and become more reactive. For men, an enlarging prostate can create persistent pressure on the bladder wall, generating the same pattern of urgency and frequency. These are two very different mechanisms, but they lead to remarkably similar symptoms. And here is something many people never connect. Certain medications commonly prescribed to adults over 60, including diuretics for blood pressure, some antidepressants, and certain sedatives, can directly worsen bladder urgency as a side effect. If your symptoms intensified around the same time as a new prescription, that is a specific, practical conversation worth having with your prescribing doctor. The hidden triggers inside your daily routine before we talk about exercises or retraining. Let's talk about what might be actively inflaming your bladder without you realizing it. Several substances chemically irritate the bladder lining, causing the detrusor muscle to contract more aggressively than it otherwise would. The most common ones are caffeine, alcohol, carbonated drinks, and artificial sweeteners. Acidic foods, tomatoes, citrus, spicy food, can also be contributing factors for some people. Caffeine deserves particular attention. It does two things simultaneously. It stimulates the bladder muscle directly, and it acts as a mild diuretic, meaning your kidneys produce more urine. For someone with an already reactive bladder, 2 or 3 cups of coffee a day can be quietly amplifying every symptom. One practical approach: rather than overhauling everything at once, remove one item for 1 week and observe carefully. If removing caffeine produces a noticeable reduction in urgency, you have found a meaningful lever. If nothing changes, reintroduce it and move to the next candidate. Fluid balance also matters in both directions. Too little fluid concentrates your urine, which irritates the bladder lining. Too much increases the load your bladder has to manage. A reasonable middle ground for most people is drinking modest amounts consistently across meals, rather than large quantities in one sitting. Finally, constipation is one of the most underestimated contributors to bladder urgency. Your rectum sits directly behind your bladder. When it is full, it presses inward, physically reducing the bladder's capacity and triggering premature urgency. Consistent bowel health is bladder health. Those two systems are more connected than most people appreciate. Before we move into the most practical part of today's video, I want to mention, if this kind of content is useful to you, please consider subscribing to Healthy Aging Research. Every week we publish evidence-based guidance built specifically for adults over 55. The subscribe button is right below this video. It takes 1 second, and it means you will not miss what we publish next. Retraining your bladder, taking back control. Now, back to the question I asked you a few minutes ago. Are you going to the bathroom out of genuine need or out of habit and anxiety? This distinction matters enormously, because one of the most effective interventions for overactive bladder is something called bladder retraining, and it is built entirely around this idea. When you routinely respond to the very first hint of urgency or visit the bathroom preemptively, just in case, you gradually teach your bladder to expect emptying at lower and lower volumes. Its effective capacity shrinks, the urgency arrives earlier, and the whole cycle tightens. Bladder retraining works by deliberately and gradually extending the time between your urge and your response. Start small. When you notice a mild urge, delay your response by 2 to 3 minutes. While you wait, perform a gentle pelvic floor contraction, not a forceful squeeze, but a calm, controlled hold. Breathe slowly. Shift your attention to something else in your environment. Then walk, do not rush to the bathroom. Each week, extend that window slightly. The goal over 6 to 12 weeks is to rebuild a comfortable bladder interval of 2 to 3 hours during the day. Clinical evidence consistently supports this approach as one of the most effective non-medication treatments available. It requires patience, but for most people, the improvement is real and lasting. Here is something that surprises most people. Urgency is not the same as emergency. The sensation that feels completely unmanageable, it follows a curve. It rises, peaks, and then subsides. Learning to ride that curve without immediately responding is, quite literally, the skill that bladder retraining builds. The pelvic floor connection. Your pelvic floor is the physical foundation of bladder control. These muscles, which span the base of your pelvis, act as both a structural support and an active suppressor of urgency signals. When they are strong and well coordinated, they can quiet an urgent message long enough for you to respond calmly. When they are weakened, which is common after 60 and particularly following childbirth, surgery, or prolonged inactivity, even a modest urge can feel unmanageable. The important thing to understand is that pelvic floor muscles respond to training at any age. Studies consistently show improvement even in adults in their 70s and 80s. However, technique matters more than repetition. Many people have been told simply to squeeze and release as many times as possible. Without correct alignment and breathing, this approach can create tension without building useful strength. If you are unsure whether you are doing these correctly, a single session with a pelvic floor physiotherapist can make an immediate and lasting difference to your practice. We recently published a dedicated video on pelvic floor exercises specifically for adults over 60, including a technique called the zipper breath that activates the deep core before any contraction. That video is called Urine Dribble After 60. Do these 5 exercises today, and the link is in the description below. When lifestyle is not enough for most people, the combination of reducing bladder irritants, retraining, and consistent pelvic floor work produces meaningful improvement. But it is worth knowing that additional options exist if they do not. Medication is a well-established second step. There are 2 main categories, one that reduces bladder muscle contractions, and one that helps the bladder relax and hold more volume. Each has its own side effect profile, and the right choice depends on your full health picture. This is a conversation worth having with your doctor if lifestyle changes have not produced sufficient relief after 6 to 8 weeks of consistent effort. Beyond medication, specialized procedures are available, including bladder Botox injections that reduce detrusor contractions for several months, nerve stimulation therapies that improve the communication pathway between the bladder and the brain, and an implantable bladder pacemaker device that regulates nerve signals continuously. These are not first steps, but they exist. They work for the right candidates, and the vast majority of people with overactive bladder can find significant relief somewhere along the spectrum. When TOs speak with your doctor sooner, most overactive bladder symptoms can be improved through the approaches we have covered today. But please do not delay a medical conversation if you notice blood in your urine, pain or burning during urination, or a sudden and unexplained worsening of symptoms. These can signal a separate underlying condition that needs to be assessed directly. We have covered a lot of ground today. Here is what I want you to walk away with. Overactive bladder is not an identity. It is a pattern your body has developed, and patterns can be changed. Gentle recap, let's bring today together. Overactive bladder after 60 is common, but it is not inevitable and it is not permanent. It develops because of changes in bladder elasticity, nerve signaling precision, hormonal shifts, and sometimes medications you may already be taking. Reducing caffeine and other bladder irritants can produce noticeable improvement quickly. Bladder retraining gradually restores your sense of control by rebuilding your bladder's functional capacity. Pelvic floor strength gives you the physical tools to manage urgency in the moment. And if those steps are not sufficient, medical and procedural options are available and effective. Sleep disruption is also often tangled up with overactive bladder, and if nighttime urgency is affecting your rest, the combination of today's strategies alongside what we covered in our video Over 60 and Can't Sleep, 5 proven ways to fall asleep fast, may give you a more complete picture. That video is linked in the description. You are not too old to improve. You are not past the point where daily choices make a measurable difference. And you are not overreacting by taking this seriously. If today gave you something useful, a new understanding, or one step you feel ready to take this week, I would love to hear about it in the comments below. Which part resonated most with you? Your experience in this community may be exactly what someone else needs to hear to keep going. And if you are not yet subscribed to Healthy Aging Research, this is the moment. Every week we publish Calm, evidence-informed guidance designed specifically for adults over 55. Practical, honest, and always grounded in real research. As always, please speak with your doctor or qualified healthcare provider before making any changes to your health routine, particularly if you have an existing condition affecting your bladder, pelvic floor, or overall health. A provider who knows your full history can offer guidance tailored specifically to you. Thank you for spending this time with us at Healthy Aging Research. Keep going, keep building, and we will see you in the next one.